Hi, this is Dr. Eric Westman, and welcome back. It's my great pleasure to be interviewing Dr. Gary Fettke. Dr. Fettke has been talking about low-carb diets, keto diets for a long time.
How did I get into low carb? Look, I think like many, I mean, not I know your story, but mine was my own personal story. So it's quite a selfish one. So I was a fat kid, but again, if you look at today's children, I wasn't. But at the time, when you look at the old school swimming photographs, I was overweight. I was a good swimmer, good sport, but my mum had me on diets when I was, 10. I can still remember the Israeli diet, which was, eating apples all day. But so she was trying to get my weight under control. I wasn't hugely fat, but I was just, overweight by today's standards. And I took that all the way through life. So again, in retrospect, if I go back 15 years, I was obese. I was 40 odd pounds heavier than where I am now. I did have high blood pressure. I was pre-diabetic. My waist circumference was up, and I was trying to do the right thing by myself, which was, I thought, okay, I need to, I'm going to eat by the food pyramid now. And it didn't work, so I'm just going to exercise more and sure, I'd have a bit of chocolate here, but, I was actually eating pretty well by the food pyramid and putting on weight. And I've got a term, I think you may have heard it, where I say, look, if you eat by the food pyramid, you're going to die by the food pyramid. And along the way, you're going to look like the food pyramid. It's that triangular shape. And so the US food pyramid is literally, it is everywhere. And, that's the history of, I'll come back to how I kept going. So effectively, I then had a tumor at the base of my brain 24 years ago now. And I was eating badly. I was on chemotherapy. I was trying to do the right thing. Nothing was working. And then I heard about metformin in the management of cancer, which was really new stuff 14, 15 years ago. And that if people that had aggressive cancers did better if they were on metformin. And that work came out of South America, because the guy who was forgotten his name, can't remember, who was trying to actually push it in the US was getting, parlayed off to the side. And so the metformin story rang some bells for me. So hang on, metformin's about reducing sugar. Cancer sort of probably needs some sugar. Why don't we just reduce sugar rather than having a drug? I mean, that's really simplistic sort of stuff. And then I started reading about sugar. And in my practice, like most doctors' practices, we're just assaulted by this tsunami of obesity, metabolic syndrome, poor health, poor immunity, poorer outcomes than we used to have. And particularly in my practice, where I was looking after most of the diabetic foot complications in northern Tasmania, I was, where I used to see the occasional patient, all of a sudden it just became the clinic was just being overrun. Running's a funny word to turn there, but just overwhelmed by the number of people with diabetic foot complications. And, there was, I can still remember when I was starting to talk about sugar, I had one fellow in his 40s that he was at risk of, had him in hospital, and he was at risk of losing his limbs, his lower limbs. And ultimately he lost one leg and part of his other foot. And I can still remember in hospital with him out of control blood sugar levels, and he was eating ice cream. And I said, how, literally I was just gobsmacked about, why are you eating ice cream? He said, well, they told me I can. And in fact, if you actually go through the hospital food guidelines here in Australia and you take them apart, it is recommended for people with type 2 diabetes to be having the option of having ice cream 3 times a day, plus carbs for breakfast, carbs for lunch, carbs for dinner, carbs for morning tea, carbs for afternoon tea, carbs for supper, which is a massive glucose load of which the body can't handle it. And hopefully most people never get to operate on people with diabetic problems and foot problems in particular. But, and I have mentioned the time when I'm operating and you've got to amputate someone's leg. It's just horrible. It's not a decision that's made overnight. It's a journey. You might lose a bit of, and when you do
typically from infection, right? Or neuropathy, you don't feel the toe, you get infection, and then there's infection in the bone, right? You wouldn't just take off the leg because someone has diabetes, right? There's this.
No. It's because of the long-term complications. And, I describe those. The microvascular disease is where every single vessel becomes narrowed. Every single bit of tissue loses its oxygen supply or has a diminished oxygen supply. The nerves aren't working properly, so they can't feel it properly. And then all of a sudden you get a little crack in the skin, or you stub your toe and some bugs get into that. And A, they don't feel it. B, their ability to heal it is diminished dramatically. And then it starts setting off. And they've often got diets which are spiking their blood glucoses all over the place. Their diets are often low in protein. They're often low in micronutrients. They don't get healthy fats in. And all of a sudden, it's this ongoing slow degradation process. But the same process happening in the foot is happening in the kidneys. It's happening in the eyes. It's happening in the brains.